Having said all of that, let's get underway. Next up, you'll hear from Dr. Charity Dean.
Thank you, Superintendent. It's a pleasure to be with all of you here today. And I'm going to talk about why a rapid COVID test is a great tool for a public health use case. And indeed, it's an honor to be supporting California Department of Education in reopening these special schools, such a critical role they play in the students' lives. Next slide. So a little bit of background on COVID-19 tests. Quick review. There's really three main types of tests. There are nucleic acid tests, what we call PCR. There are antigen tests, and then there are serological tests that detect antibodies in the blood. Really, they're trying to answer different questions. One question is, am I actively infected with SARS-CoV-2, the virus that causes COVID? The other question is, was I infected at some point in the past? And so whereas PCR test actually looks for the RNA of the virus, the antigen test is different. It's looking for a viral protein. And so that's what we're going to be talking about today is the BinaxNOW test, which is made by Abbott. Next slide, please. So what is the BinaxNOW test? It's a very rapid test. You get results in 15 minutes. It's fairly simple to administer. You swab inside the front of the nose, and after getting an adequate swab, you stick the swab in the card. You can see a picture of it here. It's a little bit bigger than a credit card, fairly simple, and the tests come together in packages, and the results come out in 15 minutes. And so someone looks at the result, reads the result, very similar to a pregnancy test. Next slide, please. I want to emphasize that the component of rapid testing is one piece of an overarching public health strategy. It is not the only piece. This is a great graphic that shows what we call the Swiss cheese model. And in putting together a safe reopening plan, every piece of this is important. Physical distancing, wearing masks, cohorting students, having good hand hygiene and cleaning surfaces, looking at airspace that's shared and ventilation and filtration. Of course, quarantine and isolation when there's a suspected exposure or case. Testing, which is the blue slice in the middle, is a critical piece of this, but it is most critical that it's fast, cheap, and easy. And so as part of the larger strategy, testing can really supercharge the effort to get kids back to school safely. Next slide. This looks a little bit complicated, but I'm going to walk you through it. This is some of the science behind why these rapid tests are an incredible public health tool. So from the larger picture of a public health use case test, the goal is to screen an entire population. To screen a whole population for a public health use, you want a test that is fast, that you can do frequently. That means it's going to have to be cheap and really easy to use. And what this graphic depicts, and if you look at the blue line on this graphic, you'll see that the live virus, when someone is first infected with the virus, they go through an incubation period. That means the live virus is not spreading to others, it's incubating in their body. And you'll notice if you follow the blue line on this graph, that at about day 6, this person becomes infectious, meaning they're contagious. They're able to infect other people around them through the air. The number of virus copies in their body rises dramatically. And that creates this window of time during which they have a very high viral load. They're contagious to other people. And what we see is that viral load then drops quickly for the live virus in the body. It's a little bit complicated, but if you look at the days on the bottom, you can see that the red zone is the time period we want to catch. So for a public health large population screening test, the goal is for that test to correlate highly with that red period where people are infectious. That's what these Binax tests do. They have a high degree of correlation with the exact time period when someone is capable of spreading the virus. Because of that, they're able to detect the vast majority of people who are infectious. Next slide. Frequency of testing really matters. We know from various models that have been produced on the virus that the frequency of testing taken from every 14 days to every 7 days to every 3 days has a huge difference on ensuring that you find people who are infectious and remove them from the population. And so this just shows a reflection of some of that data, that even dropping the cadence of testing from 1 week to every 3 days has a massive impact. Next slide. So this is a quick summary of the antigen test characteristics, the BinaxNOW tests, that I strongly believe are an ideal fit for the use case of a population screening test to safely reopen schools. First of all, the speed. You get results in 15 minutes, and that means that on the spot, you can identify and isolate people who are infectious. The challenge with PCR, which is a great test, is that it's 96 times slower. You typically get results in 1 to 3 days based on the turnaround time of the lab. Accuracy, we get lots of questions about accuracy. I'm happy to dive deeper into it in the Q&A. But the accuracy of BinaxNOW is very, very high. And accuracy is important because, again, the goal is identify people when they are infectious and isolate them immediately from everyone else. Cost. So at $5 a piece, this is an incredibly low cost solution for population screening. It's about 20 times cheaper than traditional PCR. And the cost is important because that's why you can do it frequently. So if you look at the total cost per student or staff week, it's about $14 if you're testing twice a week. And I just want to emphasize again that this doesn't replace good infection control protocols. This is part of a larger plan to safely reopen schools. It's really an incredible tool that complements everything else that you're doing in the school. Next slide, please. I'm mentioning briefly viral genomic sequencing. It's something that is near and dear to my heart because it's an incredible tool, something that we use. It supercharges a contact investigation. And this graphic shows a little bit how it works and why. The bottom line is, as long as there are COVID cases in the community, there are going to be cases walking into schools. It's unavoidable. In a scenario where you have multiple cases in a school setting, the question is always, did that spread happen within our walls? Are our infection protocols working, or is there something we need to improve? So we use genomics, or the real term would be genomic epidemiology, to answer that question. Next slide, please. And that's the end. I'll hand it back to the superintendent. Thank you.
Dr. Dean, thank you. That was very helpful, very informative, and we